Welcome to our fatigue webinar today. Just going to share my screen. Thank you for joining us to listen in to this Managing Fatigue and Improving Sleep in Long COVID webinar. My name is Lucy Burley. I'm an occupational therapist and I'm working with the Long COVID team covering the BSW area. So that's Bath, North East Somerset, Swindon and Wiltshire. Now today comes in two parts. It's a time to listen and an opportunity to reflect on how fatigue is affecting you and some of the changes that might be possible to help you cope with that fatigue more successfully and enjoy more quality in your life. We have two parts to our fatigue webinar to demonstrate this paced approach and allow you time to reflect in between and choose to listen to those two parts separately if you wish to, or straight back to back. So please listen to both parts as the information follows through, and you'll need to have both sections to be able to understand fully how to manage your fatigue more effectively. We will have a short mindful restorative moment to relax near the end of both part 1 and part 2 of each fatigue webinar. And please contact your GP or the Long COVID team if you require further support after listening to today's webinar. Now, what is long COVID? Well, long COVID consists of over 200 listed symptoms, and there are common symptoms such as fatigue, chest pain, loss of taste and smell, and breathlessness, brain fog. So those are some of the ones that you'll hear most about, but there's also a vast array of other less well-known symptoms such as loss of pins and needles in your hands and feet, or muscle aches and pains, gastric problems, loss of appetite, weight gain or weight loss, skin rashes, um, sometimes tinnitus, hair loss, a huge amount of different symptoms that can affect people to different levels and degrees. And it's unclear why some people continue to experience symptoms for longer. Several suggestions are being put forward. We understand so far that their immune system can overreact to the virus, triggering a cytokine storm, and this causes inflammation and could have an impact on those ongoing effects and symptoms continuing. We understand at the moment that the body, when it has the acute phase of COVID, goes into that fight or flight response. And the autonomic nervous system and the immune system are both disrupted. And that's why we're wondering whether these cytokines are elevated in the blood, causing that inflammation to carry on. So even when the initial COVID infection subsides and your body has dealt with that, those symptoms carry on because your body is in this response of being on high alert. It's in a stressed state, and the nervous system is not working properly to be able to lessen those symptoms continuing. There's lots of research going on at the moment, so no doubt we will learn more in due course. But at the moment, that's our understanding, and that is how we're basing our evidence of treating these symptoms of fatigue, brain fog, breathlessness on other conditions that have similar symptoms. There's also a thought that there could be microclots in the body, and that the reduced oxygen supply could have caused exhaustion and effects to those areas of the body, and that symptoms then can persist from that. But we will know more when the research has concluded. There's also a link between the autonomic nervous system and gut inflammation. And the virus may affect the different gut bacteria that could be present, and this could leave these symptoms persisting. And there's definitely a link between the gut-brain response in the enteric nervous system. And there's also thoughts that the virus can remain within your body for some time after the first diagnosis, even though some patients can test positive or negative, that residual virus can persist and cause the symptoms to continue. So we understand that there is a huge role of the autonomic nervous system within long COVID fatigue, and that this immune disruption of this nervous system is taking place, causing a lot of these symptoms to persist. And we understand then that there's a raised level of these immune messengers, these cytokines, and possibly that there has been cell change, although we're yet to fully understand that process, and we await further research findings. The symptoms are usually transient and episodic for most people, and for most they are improving over time, although it is taking longer than we would wish or anticipate, and recovery tends to be quite slow. Unfortunately, there's not a nice linear recovery where people continue to make improvements. It tends to be where people make some improvement, then have a setback, then make some more improvement, and then a setback. It tends to be very episodic, and it's hard for people to keep motivated when that is the picture. And symptoms can persist for a long time, such as the common ones for fatigue, dizziness, poor sleep, breathing difficulties, irritable bowel issues, anxiety, palpitations, chest pain, soreness. So those can persist to different degrees, and they can come and go and be transient within that episodic nature of recovery. And we know that recovery is by tapping into this parasympathetic nervous system, by looking at there's two clear parts of our nervous system. There's the sympathetic side, that stress side, the fight or flight response, and then there's the parasympathetic side, the calm side of our nervous system. And we understand that those aren't working properly, and we need to tap into that calm side of the nervous system to work properly and balance again. And relaxation and using restorative breaks, that sense of neurological rest and pacing activity are really helpful to managing fatigue and lessening the stressed response that your body is in. So now this is a sleep study. Don't worry too much that you can't see the finer detail. I want you to just look at the colours. This is a sleep study done with fit and well people. So on the left-hand side, you can see it's red. That's representing day. There's interspersed with slight green. So the red is where the sympathetic nervous system, that stress response, is working, and the green is the parasympathetic, that calm side of the nervous system. And so the left side is day, the right side is night. So you can see that throughout the day, there's quite, a lot of red, interspersed with small amounts of green, and then refreshing sleep on the right hand side at night, because most of that is green. So that's going to be a really helpful, useful sleep with cell renewal, and that person is going to feel refreshed when they wake up. Now, the same sleep studies were done with people post-COVID, about 8 months after they had the initial infection. And you can see it's quite different. So on the left-hand side, you've got the day, and the right-hand side, the night. So on the left-hand side, you can see there's a slight little bits of green, but mostly red. But the night is quite different. So this person isn't getting that refreshing sleep. Their stressed response, that high alert phase of the body and is working throughout the night. So they're going to wake up feeling really exhausted. They're not going to be recharged and have energy in the morning. How does this fatigue and tiredness feel? It's very difficult for people to understand how fatigue feels unless you've experienced it. It's hard for people with fatigue to describe it clearly, and often people look well, so they struggle for others to understand properly and appreciate how they're feeling. So when we're tired, we usually have completed a good amount of activity. And so that tiredness is expected from what we've done. And we might feel some natural muscle soreness, but that's alleviated by rest and sleep. And our batteries are recharged at night, and we can then have a rest and then have enough energy again to face that high demand activities another day. Whereas when we have chronic fatigue, we are feeling as though the plug has been pulled. It's a complete energy drain. We have huge muscle aches and pains, and it's like walking through treacle or mud. It's that sense that you can't keep going, and it's not alleviated by rest and sleep. Our batteries don't fully recharge, and it's therefore too much high demand activity leads to crashing, and you're literally running on empty and beyond. It's useful to use the analogy of a battery to describe how we understand our body is using energy and how we can top that up, and tap into that parasympathetic nervous system, that calm side. So imagine trying to operate a mobile phone with an old battery that no longer charges properly. So for times it will work for a short time period and then it will fade. And after rest, it will work for a little bit and then but not last as long. And you'll need to stop and rest and recharge those batteries more and more regularly. So when we're understanding about how to help manage fatigue, this is a really useful way of understanding that if we are, say we wake up in the morning and we're on 50% energy, then we want to be able to use a bit and top it up. So that do a bit, rest a bit approach of pacing. If we have our 50% when we wake up and we do all our activities all morning and then we're running on empty, so we've gone down to zero, and then in the afternoons, we need to recover, or we use up all our energy and then we need to recover for several days afterwards. So if we use, and that recovery time will be much longer if we let the battery go to zero. If we get up in the morning, get washed and dressed, then have a little mini restorative moment, a little bit of relaxation time, a little bit of meditation, maybe as little as 5, 10, 15 minutes. Then hopefully we might have used a bit of our energy battery, so we might have gone from 50% down to 35, and then we can top it up. And that recovery time will be much quicker if we catch it early. So we use a bit, top the energy up with a relaxation or meditation. It's about achieving that quality of rest rather than sitting, resting, scrolling through your phone or having the TV on in the background. It's about working out how you can achieve quality restorative rest to top up that battery and tap into that parasympathetic nervous system. So in terms of our activities, we all tend to base how much we do on how we feel each day. So if we wake up in the morning, we might have a better day and we feel able to do all the things on our to-do list. And the to-do list gets longer and longer. And if you've your good days are few and far between, you might think, right, I'm going to tackle right the way through that to-do list, and plow through and ignore some of the early signs of fatigue creeping in. So You might actually overcompensate and do lots on good days, and then inevitably people crash and feel much worse afterwards. But we feel good about doing those things, and we want to be able to do our to-do list because we don't know when our next good day is going to be. But it's about having that sufficient recovery time and post-exertional malaise, that sense of when you do activities that then you might suffer for it, not in that moment, it might actually be delayed response. So you might do something on Saturday and you might not feel that fatigue and malaise until the Monday. And so it's quite difficult to understand how the body is responding to those activities and knowing what has caused that crash and period. But it's useful to look at your whole week rather than just each day as one. This activity cycling diagram just explains that in more detail. We often refer to a boom and bust cycle or peaking and troughing. And you can see here that people on their good days will do lots and lots, and then inevitably they have a crash where they feel much worse afterwards. And that, as I said, can be delayed. It can be that day, or it can be the next day, or even the day after that. And then over time, you can see if people continue to do this boom and bust pattern where they respond in the moment to doing lots when they have good days and then suffering afterwards and allowing time for recovery. That recovery time gets more, and also the level of activity gradually becomes less over time. So this isn't an effective way to manage chronic fatigue with long COVID. It's helpful to be able to narrow these two levels up and actually to do less on a good day and not do so sort of less than the maximum on a good day, but more than the minimum on a bad day, so that you can have a more even line and gain a sense of control about how you're managing what you're doing each day. And that's why it's useful to look at a whole week rather than each day, so that you can gain some sense of control. And that way you'll be able to plan ahead and think, well, next week I can plan that activity because I know that each day is going to be fairly similar, rather than wondering, actually, is that going to be a good day or a bad day? We're going to look in more detail about these 5 P's of pacing. Pacing is the key to managing fatigue. We're going to talk a bit about planning, problem solving, prioritizing, pacing, and praising. And all of these work together to enable you to make adjustments in your week, make adjustments in how you're doing activities, how you're planning ahead in order to manage those symptoms more effectively and bring about that sense of control. And also praising yourself along the way for small achievements. It's really important to be kind to yourself and allow yourself to learn effectively how to manage those symptoms in a more useful way. Now we're going to have a little mindful moment shortly. And relaxation is the cornerstone to really the foundation block of helping you to pace and manage that fatigue more effectively. As I said, lots of people talk to me about the way they rest, and they might describe that they just sit down and switch off. But when you actually delve into what people are doing during that time, they might have the TV on, the radio on, they might be scrolling through their phone, looking at social media, or reading a book. Now, all of those activities to me are stimulating to the brain neurologically, and they often have busy movement, light, sound, actually stimulating thoughts, as well as the vision, hearing. So stimulating our senses which isn't neurological rest and isn't going to tap into that parasympathetic, the calm side of our nervous system, which we know is disrupted in long COVID. So, in order to help yourself to manage this fatigue better, we need to make sure that each of you are looking at ways of gaining that restorative rest regularly. Um, Little and often is best. So 5 minutes, 10 minutes, up to 15 minutes of using meditation, relaxation, gentle Tai Chi, just listening to birdsong, tapping into nature outside. So if it's nice, sit outside and look at the the minutiae of nature, notice the seasons, notice the tiny bits of a flower or a leaf or trees. Um, just taking that time out, as using mindfulness techniques, sensing through the body, working on your deep breathing, tapping into that diaphragmatic breathing. There's lots of different techniques, and it's useful to find what works for you. Not everybody can sit still and close their eyes and be in that moment doing meditation. So if that's for you, great. If not, find something that does suit you. But the key is doing it little and often through the day, rather than doing lots of activity and then having a period of recovery afterwards. So if you can top up that battery sooner by using a bit of energy and then topping it back up by doing 5 to 15 minutes of regular time out relaxation, it's going to be really helpful to enable that paced approach to managing the fatigue better. There are lots of free apps like Mindfulness, Insight Timer, um, Calm. Some of them you can get free parts, and some of them you have to pay extra to tap into to other um, more in-depth parts of that app. But also you can gain lots on YouTube. There's 5 minutes of Tai Chi, gentle Tai Chi on YouTube, and lots of meditation, free, accessible scripts on YouTube, or the local libraries also have relaxation CDs you can borrow. So there is ways of, and I'd urge you to try lots of different techniques to see what suits you. And then once you've found what you like and what works for you, stick with that. But little and often and regular is the key. So I'm just going to end this part one of our webinar with doing a grounding technique. And we're just going to take a few minutes to have that's the mindful moment. So this is just a short relaxation, focusing on experiencing your 5 senses in this moment. You can practice this anywhere, at any time, and it may help you feel more grounded and calm. So begin by finding a comfortable, upright posture with your feet grounded on the floor, your spine in line, and your hands resting on your lap. If you're able to lie down, just find a restful position on your back with your legs stretched out and arms by your sides. I'd like you to count 3 breaths in and out. Keep your eyes open, resting your gaze on a neutral space. And now we're going to turn your attention to your senses in this moment. So start by looking around you, counting 5 things you can see. If you feel comfortable, you can close your eyes, and if you'd rather keep them open, rest your gaze on a neutral spot. I'd like to bring your attention to any physical sensations and count 4 things you can feel. focusing now on sounds around you, counting 3 things you can hear. And moving down to your nose, counting 2 things you can smell. Turning to the final sense, noticing 1 thing you can taste. And now that you've journeyed through all the senses, you may want to return to the sense that helped you feel particularly calm and at ease. Seeing, hearing, feeling, smelling, tasting. Or you may want to simply rest comfortably in this space for the next few moments. And now I'd like you to count 3 breaths in and out. And when you're ready, I'd like you to start making some small movements, wriggling your fingers and toes. Start sensing the earth beneath your feet and the chair supporting you or the sofa. And when you feel ready, open your eyes as this relaxation comes to a close. So that's just one example of relaxation, a grounding technique that you can use whilst out walking, but as well you could sit still and make it even more restorative, resting your head and limbs in a supportive position. Um, so that's just one example, but there's lots of different techniques out there. Then you might find that ones are more suited to you. So try those regularly to support this paced approach to managing fatigue. So this is the end of part 1, and I would going to stop the recording now, but please return and listen to part 2, where we will look in much more detail at those 5 Ps: the planning, the problem solving, the prioritizing, the pacing, and praise. And we will go through each section with lots of different trips, tips and techniques to help you manage fatigue more effectively. And we'll also look at how you can ways to improve sleep, which is often a common difficulty as well. So thanks for listening today, and come back for part 2.